I don't know if you guys have seen, but from the International Stroke Conference in February, there was a fantastic presentation that everybody's been talking about. And it is really about the position of the patient's head prior to thrombectomy for large vessel occlusion and outcomes for patients. It's a study that was done by Dr. Ann Alexandrov out of the University of Tennessee. And she's a nurse researcher, and she studied the difference between 0 and 30 degrees of the head position prior to thrombectomy to be able to see patient outcomes. And they found significant improvements in patient outcomes, so much so that they had like 92 enrollees in 12 centers, and they had to stop the study early because people were doing so much better. So the NIHSS's prior at 24 hours after the thrombectomy and at 7 days after the thrombectomy were so much better in the head down, head flat group. And in that, they found ultimately at 3 months, everybody's NIHSS was equal. And they didn't really expect that big of an improvement because thrombectomy itself is a fantastic treatment for large vessel occlusion. It is what you need. And head of the bed position is not a treatment modality. Very, very cautious to be able to say that. But it's so important in preserving the cerebral perfusion that it makes a big difference and can have within 7 days can lead to better outcomes and maybe even less rehab time. That's amazing. Check it out. I have the link below.